Welcome you all. I am Dr. PJ Madam Rafi. Today we are going to discuss about insulin and its types and their uses and their indications. Okay. So first of all, before entering into the topic, first we have to know pancreas has both endocrine and exocrine functions. Okay. Based on these endocrine exocrine functions, they secrete some hormones into the circulation. Okay. So what are those? We'll see. Exocrine secretions will be pancreatic amylase, trypsin, chymotrypsin, pancreatic lipase. These are the hormones they will secrete into that by exocrine secretions. Okay. So there will be endocrine secretions also there, which were glucagon will glucagon is secreted from A cells of pancreas, insulin is secreted from B cells of pancreas, somatostatin is secreted from D cells of pancreas, then pancreatic polypeptide cells which are secreted from F cells of pancreas. Okay. So in this, these are the two secretions, that is exocrine secretion and endocrine secretion. Next is insulin normally consists of 51 amino acids. They will be arranged in two chains. This is an MCQ. Insulin consists of how many amino acids? 51 amino acids. Okay. By two chains, that is A chain and B chain. A chain consists of 21 amino acids. B chain consists of 30 amino acids. They both are linked with C peptides. Okay. That is also an MCQ. If they are asking particularly B chain consists means 30, A chain consists 21. Total 51 amino acids. Okay. Next. So next we will see insulin, how insulin will get secreted into the by endogenous secretions. Okay. First of all, when we are taking food, it will get absorbed, okay, by in the form of glucose. When glucose is absorbed into circulation, it will enter into the pancreatic cell through GLUT transporter. That GLUT2 transporter. Okay. By when this glucose is entering into pancreatic cell, it will obviously pancreatic cell will have mitochondria. It will generate ATP. Okay. This ATP will inhibit this potassium channel. Okay, for ATP dependent potassium channel. When it inhibiting ATP dependent potassium channel, there will be internally potassium will be rise. It will lead to cause membrane depolarization. Okay, when membrane depolarization happen, it will lead to cause influx of more calcium into the pancreatic cell. Okay, so when more calcium enter into the pancreatic cell, obviously inside the pancreatic cell, the B cells will produce this insulin hormone. When this calcium will be intracellularly increased, it will helpful in releasing of insulin into the circulation. Okay, thereby it will release into the circulation. This is how insulin will get secreted into the body by endogenous secretions. Okay, if we see one more time, first one is glucose entered to GLUT2 transporter. There it will produce ATP. This ATP inhibit potassium ATP channel. When potassium is inhibited intracellularly, potassium will rise. So it will lead to cause membrane depolarization. When membrane depolarization happens, it will allow more calcium intracellularly. This intracellular calcium will cause contractions of beta cells. Thereby insulin will get secreted into the circulation. Okay. So next is, what are the actions of insulin? Okay, they have two actions: carbohydrate metabolism action and protein metabolism action. First we will see carbohydrate metabolism action. And the liver, it will increase glycogen synthesis. Next one is decrease glycogenolysis, decrease gluconeogenesis. That means overall if you see, they are decreasing the glucose level in the body. That means they are increasing glycogen synthesis, one thing. Second one is glycogenolysis, they are decreasing. That means there will be no production of glucose. At the same time, decrease gluconeogenesis. Okay, new glucose formation also they are decreasing. That means they are decreasing the glucose level in the body. Next is muscle, increase glycogen synthesis, there will be more deposition of glucose in the muscle. Next, increase glycolysis to product, they utilize more glucose. Okay. Next, in adipose tissue, they increase glucose by GLUT4 transporter. Okay, these transporters are very very important. In adipose tissue it will be GLUT4, in pancreatic it will be GLUT2. Okay. Next is inhibit lipolysis, increase lipogenesis, increase triglyceride deposition. If you see all, they are increasing lipo fat deposition. Okay, that's the main thing. If you see in protein, liver it will break down protein. In muscle it will increase protein synthesis. Okay, these are the actions of insulin on carbohydrate. and protein. Okay, that will be different actions. They have to remember what is the action on liver, what is the action on muscle, what is the action of adipose tissue. Okay. Next is different types of insulin preparations. Okay, there are normally four types will be there: rapid acting, short acting, intermediate acting, long acting. We have to remember the names based on the types. Okay, if it is rapid acting, obviously insulin lispro, aspart, glucin. Okay, these three are rapid acting. Their onset action will be 20 to 30 minutes, maximum half an hour only. So peak will be one to 1.5 hour only. The duration will be 3 to 5 hours. Okay, in short acting we have regular insulin. This is the most common used insulin. The onset will be within 50 minutes to 1 hour. So duration of action will be 6 to 8 hours. Okay, next in intermediate action we have lenti insulin or NPH insulin. Okay, in long acting we have insulin glargine, determin and degludec. Okay, so you have to remember the names based on rapid acting insulin. They are asking, they will ask what are the types, means insulin aspart belongs to which group, or insulin lenti will belongs to which group, or glargine belongs to which group. Okay, so you have to remember the names. If it is insulin lispro, aspart, glucin, it is rapid acting. Short acting will be regular insulin. Intermediate acting will be insulin lenti insulin or NPH insulin. Long acting will be glargine, determir or degludec. Okay. Next, therapeutic uses of insulin. Okay, it has to be, insulin will be obviously useful in type 1 diabetes, type 2 diabetes, gestation diabetes. Finally, most important critical conditions like diabetic ketoacidosis. Okay, so next one is adverse effects of these insulins. Obviously, they won't raise the glucose, so patient will have episodes of hypoglycemia. Is the most common and frequently happen adverse effect because of insulin will doesn't increase glucose level. So hypoglycemia is main thing. Next is lipodystrophy, because in the injection set they will have chance of lipodystrophy, and mostly insulin resistance. Okay, these are the major adverse effect, and most commonly will be hypoglycemia. That's all. Thank you.